Hi, my name is Nicole Werner, and today we're going to talk about the cricothyroidotomy, also known as the surgical airway. As surgeons, we're often asked to perform this when anesthesia or in the emergency department, they're not able to intubate from above. Typically, it is an emergency situation, and time is very valuable. So for the Surgical Olympics, we are actually going to time you on this task from the moment this blue towel is removed until you get the endotracheal tube in place. I'm going to go a little bit slower just to try to talk through the different steps. So the first thing is, what do you absolutely need to do this procedure? It's not much. It's a scalpel, an endotracheal tube, typically a 5/0 or a 6/0, because anything bigger typically won't fit into that space. Something to secure it in, and something to inflate the tube. So the first step of this procedure is to familiarize yourself with the anatomy. So this model makes it pretty easy. You can see the chin, the chest, and then I go down the middle of the neck, feeling for the thyroid cartilage. Usually there's a gap, and then the cricoid cartilage. Sometimes you can feel the tracheal rings, but not often. No matter if the patient's obese or not obese, those landmarks are usually fairly easy to identify. Next, I take my non-dominant hand and I stabilize the airway. And the reason is twofold. One, it keeps it still, but two, it really helps me gauge where the midline actually is. Next, I make an incision. I start over the body of the thyroid cartilage, and I go over the cricoid cartilage. We go vertically because if you go transversely, you run into the anterior jugulars. Even making a vertical incision will bleed a lot. This model, just like in real life, usually takes a few cuts to get down to your cartilages. Once I think I'm through the skin and epidermis, I take a feel and just confirm that I'm in the right spot. And again, I can feel that gap where that cricoid cartilage, between the thyroid cartilage and the cricoid cartilage is. And that's where your cricothyroid membrane is. The next cut is going to be transverse. You're going to go transversely through that membrane. You're going to make a pretty good size cut, usually about 2 centimeters. And the trickiest part about this, not so much in the model, but in real life, is after you make the cut, you don't want to lose where that airway is. So you're going to protect your sharp, and either you can put the back of your scalpel in to hold that. But what I like to do is I just put my finger in as a placeholder. So my finger here is through the skin opening into the trachea itself and hook downwards so that my finger can serve as a guide to let my endotracheal tube in. I slide the endotracheal tube in next to my finger. And again, if it's pretty stiff, one thing you can do is remove the metal guide. Sometimes that makes it a little easier to insert. And you want to insert it about 6 to 8 centimeters. It's a little bit less than normal because we don't have to go through the mouth. Then you inflate your cuff. And that's where we're going to stop timing. But now let's talk about how to secure this tube in place. I personally prefer a 2-point method of securing the tube. So I go inferiorly for my first stitch. And for this, you'll only get 1 suture, so use it wisely. I secure it to the skin. I throw a few knots. Then I wrap around the tube. You can go once around the tube, you can go twice around the tube. Then you tie. Some people might stop there, but I caution you in that because if there's enough downward force, you can see it could probably pull that tube out. So this is where that second point comes in. So I go from above and do the same thing I did below, where I first tie down to the skin. Again, this helps with some hemostasis too, so that's an Added bonus. And then I wrap around the tube and throw some knots. I push pretty hard to try to avoid the air knot because you just don't want this tube to move. And they're pretty good at falling out if not secured. And so you can see that tube is very well secured in place now. And that's all there is to it. That's your cricothyroidotomy.